anterior nasal swab is probably the least invasive and easiest to perform. So you insert the swab into one nostril and you circle the anterior nostril about 10 to 15 times. Then you go on to the next nostril and you repeat the same thing. The swab only really goes in about 1 centimeters. So you can insert the swab until basically you can't see the cotton at the end of it, and then start your procedure. As you can see on the left, the swab is only inserted a very short distance, and you swab the anterior nair and you repeat that on the other side. On the right, you can also see that as well. So it's a very non-invasive, very quick, and very simple to do. So educate the patient about the procedure and possible discomforts. Insert the swab approximately 1 centimeter into the anterior nair without going into the nasopharyngeal passageway or going up into the turbinates. Move in a circular motion for 10 to 15 seconds and repeat it in the next nostril. Inform the patient when it's done, place it in a medium, secure it, label it, and always confirm your 2 patient identifiers. Special considerations are piercings. If you see them have a nose piercing, then you definitely want to skip away from the area that the piercing is secured. So you can swirl all the other areas except for that. Contraindications: if there's a nosebleed, if there's any recent surgery, or a new piercing. Now, what I will say about piercings is this: everyone is different. Some people recover from their piercings within a month, others within 6 months to a year even. So ask the patient, know your patient, and ask them what they prefer. Remember, this is not black and white. Look at your clinical setting, look at your patient, and listen to what your patient is telling you. That concludes the anterior nasal swab.